something. Good.
Terrific.
All right.
Okay, Bill, then over to you.
Very good. Well, thank you very much, and welcome everybody to our webinar on Aim Higher for Healthcare, the healthcare that we all deserve. Thank you for joining us from right across Canada. It's so good to see so many of you here. And we also want to remind you that this event is not only being broadcast on our Facebook feed, but it's also is being recorded, so that there will be a link on the carp.ca website following the event, and you'll be able to go in within the next day or so. It takes a little time to render it and put it up. You'll be able to go in and see it again, and also recommend it to or send it to your friends. My name's Bill VanGorder. I'm the Chief Operating Officer for CARP and the Chief Policy Officer, and I'll be your moderator for today, which promises to be a very interesting session with three experts who I will introduce to you shortly. At the end of the discussion, we'll also have time to answer the questions that you might have, so please feel free to put them in the chat section. The chat is being monitored by CARP's Anthony Quinn, and Anthony will make sure that we hear your questions at the end of the discussion, and that's the best place to make sure that your questions are answered. If you want any questions directed to a particular speaker, please say so. Our CARP campaign to help Canada aim higher for the healthcare we deserve came as a result of important gaps in our health system that were very clearly exposed during the COVID-19 pandemic. Our country paid a heavy price because of our inadequate health system, especially older Canadians, many of whom lost their lives or saw their health deteriorate, and we continue to pay a high price as our healthcare system struggles to catch up with postponed surgeries, tests, and procedures, including lethal diseases such as cancer. And we're now starting to discover the cost of decades of inaction. You know, compared to other comparable countries, Canada has consistently ranked near the bottom when it comes to many areas of the health system. Let me show you a few key statistics. These are not just made up figures. These will show you that they'll demonstrate very quickly how badly we fare compared to other countries. A recent study by the Fraser Institute of countries and universal healthcare systems like Canada compared the resources available on a population basis by age. And as you can see in this graph, we rank second to last in acute care beds per 1,000 people, second to last over 1,000 population at just over 2. It's much the same for physicians. Canada is a third to last in physicians per 1,000 population. So we don't have the hospital beds or the doctors that we need. We're also near the bottom of the pack for sophisticated medical equipment, such as computer tomography and CT scanners. As well, based on another recent study, we see that Canada ranks 18th out of 20 comparable countries for the time it takes to have access to new medicines. It takes 2.5 years after a medicine first gets approved, 2.5 years before it gets approved in the world for us to get access. All of these statistics show exactly why we need to aim higher for the healthcare we deserve. We can and we must do much better. And our CARP members agree. We had a recent survey of CARP members that shows that our members want high quality and timely access when it comes to new medicines. Here are the 3 findings of that survey. 1, near unanimity when it comes to the belief that new medicines should be available to Canadians at the same time as other major countries. And 9 in 10 believe that access to new medicines and vaccines is critical to treating serious diseases such as cancer and dementia. And 9 out of 10 agree that any future national Pharmacare program should include comprehensive access to the best medicines, including new medicines. So how can we move forward in our healthcare system to get to where we need to be and deserve to be? CARP developed the following 3-point health action plan to help inform this overdue transformation to aim higher for healthcare. Number 1, the first pillar, investments. We need to boost investments in provincial health systems to clear the backlogs and build back better. The second pillar is accessibility. We need to make medical innovation widely available so seniors can be well. And the third pillar is independence. We need to help seniors stay in their homes longer and reform long-term care by building and staffing critical infrastructure. Well, that's my brief report on the need that we have to aim higher for better healthcare. So now let's move on to our expert panel to discuss two themes. 1, building a better health system, learning from the crisis, and 2, the role of innovation in healthcare. And again, a reminder, you can submit your questions whenever you wish by using the chat panel. We have 3 guests with us today. We really appreciate them taking the time to share their knowledge and experience on these key discussion items. From Montreal, we have Dr. Gerald Batist. Gerald's a medical oncologist, director of the Siegel Cancer Center at the Jewish General Hospital, director of the McGill Center for Translational Research in Cancer at the Lady Davis Institute. He also directs a large clinical and laboratory research program, and his own research interests include molecular pharmacology and the development of new cancer therapies. Next, we have Trish Barbato. Trish has been president and CEO of the Arthritis Society since 2020, giving her a new direct view of the impact on the pandemic on patients. As well, for more than a decade prior to that, she was in a variety of senior roles with Revere Inc., a senior living provider. She also has previous experience as an executive in the health system. And our third guest is a man who surely needs a separate closet for his numerous hats, Dr. Alan Lowe. Dr. Lowe is a CARP member. He's executive director of the MedAccess BC, which works to improve BC residents' access to life-changing medicines. And he's a frontline pharmacist as well as a professor at the University of BC, where he teaches various courses for pharmacy students. So thank you very much to the 3 of you for joining us. We really appreciate it. And this time is so valuable in terms of giving Canadians the information that they need to have so that we can aim higher for healthcare. So getting into the questions, and I'm going to start out first with a question, Jerry, to you. We all know that COVID has had a devastating impact on cancer care in Canada. So what did we learn from the pandemic, and what can Canada do to correct the course for better cancer care?
Well, thank you very much. I'm really pleased to be with all of you today, and I appreciate the question. From the very start, when we first read a report in Lancet from Wuhan of the first several hundred cases of COVID-19 back in 2020, 18 of them had cancer, and we already knew that this was a problem. And we saw as our mission twofold. One was to protect our patients who were at increased risk of getting the infection and getting really sick or dying because of the infection. And secondly, and I think relevant to today's discussion, to protect them from delays due to pulls on the system to treat COVID directly, so that we understood right from the beginning that a lot of resources were being pulled away, beds, operating room times, everything to help in the acute event. And although we were very, very good at protecting patients, it was very, very difficult to do the second mission. And as a result, we're now experiencing a tsunami, a veritable tsunami of cancer patients, often with diagnoses that are more advanced than we would have expected in the past. All of that due to delays in screening, surgery, initiation of all kinds of therapies, endoscopy, etc. And all of the models show us that we can expect, and we're already starting to see it, increased mortality in the next couple of years as a result of that. So it's not, doesn't look like it's just simply delaying things, but a delay that has a cost. And the models also show us that in order to mitigate that increased mortality, we have to increase our capacity by as much as 30%, which is simply not possible for the reasons, Bill, that you showed. We're really limited in our capacity to start with. And so we have two approaches that really kind of align with what you're describing, and they involve innovation. First, innovating in terms of the way that we do things. And actually, in the context of the pandemic, we've learned to do things more efficiently and use technologies more efficiently. So we have to be better at what we do. We can't keep doing it the way we used to do things. But the second is we can't keep doing the same things, even if they're more efficient. And that means, again, it has to do with one of the slides you showed, drug access. The way we access state-of-the-art drugs in Canada because of the delays in approval is by putting patients on clinical trials. That's how we access drugs that have already been shown to be effective and have been approved in other countries. And we have to ramp up our clinical research, even as we ramp up pressure on regulatory agencies to get the drugs to our patients faster. So innovation in terms of better way of functioning, cutting out a lot of the delays in the system, doing less things in parallel, in sequence, and doing them in parallel, and then more clinical research, and ultimately reformation of the regulatory agencies.
We've been told that although, as you pointed out, we need to increase what we're doing in general by as much as 30%, that it would take less in terms of an increase in funding. In fact, that a 10% increase in funding might accomplish that. Is that true? Because that, if it is, that would make it seem like it is doable.
Yeah, I would say if we did it with innovation in mind, that would make sense. If we keep doing everything the way we've always done it, it likely would cost even more than a 30% increase. So it requires innovation at all levels, the managerial, administrative levels as well. And government has to do things in a different way.
Good. Well, thank you. Yes, we can't keep doing things the same way and expect it to be different, and we can't just tweak the system. Well, Trish, a question to you then. We know that Canada's healthcare system is underperforming compared to many countries. We showed that earlier. What can we do differently? Are there best practices that you see in the arthritis community here and abroad that could be applied both to your work and everyone's? Whoop, you're on mute.
Thank you so much, Bill. And I really appreciate CARP's very first pillar around the backlogs. Your audience, amongst the people who are 60 and over in Canada, 4 million of them, almost 4 million of them have arthritis. So it's a disease that is quite prevalent, and no province prior to the pandemic was meeting that 6-month target for hip and knee replacements, as an example. And the pandemic just greatly exacerbated, I like Dr. Batist's word about a tsunami, where the CMA reported that those wait times had increased by another 2 months, as an example. So we were already not meeting the 6-month target for all of our patients. Now we've added another 2 months. So I think that we're going to see a very similar response around people who have been waiting, who do not have a diagnosis. And I think that all of the things that we're talking about, it's funny, even though it's a different disease, but the innovation is so important. The earlier diagnosis will give you a better outcome. It's also true of arthritis. So if people, for example, have access to therapy, to have access to other kinds of treatments, they could get off potentially that wait list. Maybe they don't actually need the surgery. And so we think about more preventative, more education. One of the things that I saw on the OECD data was that Canadians, almost 60% of Canadians are overweight and obese, 60%. That is a big number. And we know that that contributes to many diseases and certainly contributes to arthritis. And so how do we empower people around those preventative areas? How do we have access to treatments, equitable access? I kind of joke around, we really, love our healthcare system. We sort of have now a love-hate relationship with it, but it is not universal. We do not have a universal healthcare system in Canada. And so thinking about what are the tenets of that healthcare plan that really make the most sense, and how do we modernize it? It was created back, in the 60s, it was created around an acute care model. And we now have technology, and we have communities, and we have hard to serve areas because we're such a large geographic area. How can we ensure that data that is effective around interoperability and all these other things? How do we infuse that modern take? How do we infuse that modern structure and administrative? I think, again, some of the things that Dr. Batist was talking about. Let's not lose this crisis. Let's not lose the benefit of this crisis. Let's ensure that the things we've learned and the things that make sense, we embed them deeply into a new way of doing things.
Good point. Very good. All right. Alan, a question now to you. Canada's healthcare system has been notoriously slow in embracing innovation, and Canadians pay the price because of diminished care and health outcomes. What's holding us back? What needs to be changed? Thinking about medicines in particular, as a pharmacist, a leader in BC, and a CARP member, I'm so proud to say, are there any lessons from COVID we could take away so that we're not held back from improving the slow and embarrassing care that we're giving our citizens across the country?
Thanks, Bill, for that question. And I'm happy to be here with the group, and nice to see representation from across Canada. I don't want to just focus on drugs, because there are other means and ways to also keep ourselves healthy. But sometimes, of course, it does come to drugs. And you have presented a graph where in Canada, it takes a long time for a drug to be marketed and available in Canada. And something that wasn't mentioned that I'd like to point out is that not only does it take a long time for it to reach Canada, but we're seeing that Canada's on the latter half of the list when it comes to new drugs being introduced as well. That means that drugs are being introduced in other countries that are developed and not making it to Canada. And largely that's because of the significant amount of controls that are in place. Part of it is the approval process, but the other part of it is just the price controls that have been introduced and suggested. And this comes from the Patented Medicine Prices Review Board, or the PMPRB. It's a government-funded group which is there to control excessive prices. But recently there were some changes that were both announced and then rescinded, and then now looking at how to renew and do other changes to these guidelines. And the problem with price control is that it does stifle innovation. It's setting up rules and difficulties all based on price, which makes it for some research and some research companies, et cetera, not to bring innovative products to Canada. So in the past couple of years, we have seen that the numbers compared to other countries are dropping off. So Canada is not at the top of the list or close to the top as we should be with compared to developed countries. But we do see that in the pandemic, there are ways to do it better. We have seen that COVID vaccines and treatments were fast-tracked. Again, we were one of the better ones. We weren't at the top, but Canada was doing okay. And that means it's possible. We rolled the products out, we got them approved, and unfortunately our rollout wasn't quite as good in Canada. So again, this comes down to maybe too much control being done by government, but we see that the rollouts, and even today you talked about earlier on before we started about getting booster shots, and then people are being invited and can't get it until they get kind of the tap on the shoulder. And it's these kinds of things that we need better technology, embracing innovation so that we can be efficient at doing that. We do know that what's happening now, even with the fourth shot booster, that there are vaccine that is being wasted because of the mechanism that we have in rolling this out. So there are lots of learnings that we can have from what we've seen in the pandemic so that we can improve on this. And, you know, as Trish was saying, we should not lose the learnings and what we've found to work well and how we've changed. But it did take a pandemic to provoke us to do something differently and to do it better and to also spend the dollars. And, you know, part of the reasons that we are so behind is we have such a focus on cost containment when it comes to government-run programs, government-funded healthcare, that the focus is too much on cost. and short-term costs. So it might be because of our election cycle, it might be because of how the country is run, but this is where it kind of points to the Canadians and people in CARP to step up and advocate and to make your voices heard, so that what we need as people of Canada to get the healthcare that we need, and we do need an overhaul of some of these archaic and older policies and rules that have been set up. The Canada Health Act is very aged, needs to be looked at again. And so this universal access to care, I think COVID has really pointed it out, and we know we can do it better. COVID treatments and vaccines were open to every Canadian. So every Canadian, if they wanted it, could get it. Getting access to it because of logistics is still a problem. But at least from a medicine's coverage point of view, it is no charge to a Canadian directly, but of course, through other means it's being paid for.
Good, great. Some questions now for everyone, and Jerry will maybe start with you on this one, but there are some key provincial elections coming up, not just the one in Ontario in June, but others in Quebec and other provinces coming soon. We also have some very new elected governments in other provinces. What health priorities do you think political parties should focus on? Jerry, we'll start with you. I think you're muted still. There we are.
Thank you very much. First of all, I think the one very important issue for all of us is to insinuate the health care issue into the campaigns. They can quickly get lost in other things. As we saw here in Quebec, for example, we at the beginning of the pandemic, the long-term care facilities was a high priority and cancer care was a high priority. But as other things started to mount up, political questions and the financial situation came to the fore, some of these things had less emphasis. So there has to be not only a financial recovery plan, but there has to be a healthcare recovery plan. I think we really need a focus on doing things differently, building more buildings as opposed to recruiting more care providers is a path that is very easy to kind of slip into. And I think we saw from the data so far in the census, the most recent census, that we're kind of running out of people to take care of people. And that's something that has to be addressed. So I think we have to try to insinuate our issues into all of these campaigns. And it shouldn't be so much about recrimination about the past. There's lots of blame to go around for things that went wrong. But we need people with good ideas putting them forward.
Thank you. Trish, what's the Arthritis Society looking at in terms of advocacy with governments and what they should be doing?
Yeah, we definitely care about medicine and ensuring we have a huge population with an autoimmune disease and rheumatoid arthritis, and its very many forms. And so we have a keen interest in ensuring that medicine is available to people at the right pace. And so we care a lot about that. We care about the backlogs for knees and hips. We would, we really want to see how can we get that earlier diagnosis? How can we improve the very fragmented pathways that exist? And in fact, I would extend that fragmentation of pathways to, much of the healthcare systems. I've worked from acute care all the way through to mental health and community, long-term care, home care. And what I see is, really great frontline workers who are doing their very, very best, stifled by the kind of structure that is imposed around them, and the inadequate handoffs where people just aren't getting that linkage to the next thing that they think that they need. And so, I think that's a big one. I think the inconsistency, there was another study by Commonwealth Fund around health systems in 11 developed countries, and Canada was 10th in equity and healthcare outcomes and 9th in access. And so when I think about, and I think it's coming up in the chat as well, and I really wholeheartedly believe in this, it's not just about health. If someone is working 2 jobs, they can't get to an appointment. If someone is too far to get to an urban center, they're going to miss their appointment and they're not going to get that early treatment. So there's all kind of sort of social and economic and other factors that are part of that healthcare journey. And we want to make sure that we are able to embrace that. So definitely at the Arthritis Society, we have launched an innovation campaign. We are working with innovators in the sector to try and find solutions that can directly impact. We're working on social impact projects because we think that we can be an element in the healthcare system to step up and try and bring different partners to the table to collaborate, both private and public sector, to just move forward for the patient and have them as the focus of our, of the solutions and of success.
Good, thank you. Alan, Trish and Jerry have covered a lot of ground in terms of advice to political parties. Do you have anything to add?
Maybe just a little bit, and that's around the national Pharmacare. So we've talked about how we do want fair and equitable access to medicines for everyone in Canada. And of course, the big topic now federally that's been released is a national Pharmacare system. And I think as we go to the polls and think about the elections and things like that, we're going to have to hold people accountable as well as doing it properly. And that's a concern when we talk about a universal system. And we are seeing the problems in our universal health care now with respect to MSP or medical care. We don't want the same problems coming up in drug coverage. So the problem with medicines is it's great that everybody has access, but we need to make sure that they have access to the best medicines that are suited for them, something that the patient and the physician selects, not because of some criteria and because of cost. You have to try ABCD medication that's lower cost before you can get to something that really works, that is only held back because it's a higher cost. And that's what we don't want. And we need that attention to it. And largely it comes down to maybe the short-term versus long-term thinking. So that's another thing I think we need to hold our politicians and government to, is to think long-term. And we don't do that in healthcare. You've heard this term before, that what we have is a sick care system. That means people are sick before they enter the system and get the care. We're not doing very well in that preventative care, both with medicines as well as non-pharmacological care. And we need better attention to that so that people are kept healthy versus getting them from sick to healthy, and they only enter the system when they are acutely ill. And that's a real concern. And we have to look at that. And, a lot of us say that, who's going to pay for this? And I see it in the chat that this is very expensive. But when you look at it as an investment, a healthier community and a healthier country is going to cost less to run in the future. Problem is it is going to take some investment. So when you look at our productivity, and we've seen now COVID has knocked out a lot of our workers, and we've had a real economic downturn because of sickness. So imagine if everybody was healthy and productive, that changes the economy as well. So we need to look at it differently, and we're looking for those innovative thinkers, as Dr. Batista has mentioned, that will run our organizations and handle our budgets in a better way, that has a long-term focus on it, that's looking at the entire population, not just young, not just old, but everybody together, and putting the weighting in the right places. We do know that our seniors need other supports and care, and to put that into place. There's no point in rolling out something when a senior is unable to access a computer and get internet and do certain things that they're not comfortable with without support. So roll out innovation that people can use and help them use it when it's out there.
Good, thank you. Two comments I'd like to make from our CARP point of view. Number one is there seems to be a lot of talk when it comes to national pharmacare these days about something that becomes lowest common denominator across the country. That's not what CARP is looking for. That's not what I believe you're talking about, Dr. Lowe. That's the appropriate medicines that people need across the country, not just the ones that are cheapest or easiest to achieve. And we've got to be careful of that, because politicians being what they are, that's what we could end up with in the long run, and it wouldn't put us any further ahead. Second thing I would mention is that some of our viewers might be interested to know that CARP has 5 major policy platform planks, and the fifth one, and they're not in any particular order, but the one on the list is our own older Canadians' fitness themselves, encouraging ourselves to look after our own health, to get fit, stay fit, and asking governments where they can to support that in happening, and making sure that fitness activities for our generation are available in all communities, and that community recreation and other organizations are not just responsible for running baseball leagues and hockey leagues for kids, but they have a huge responsibility for the growing number of seniors in all our communities. And that's something that we're certainly with the three of you, and you all three of you have mentioned that in one way or the other. And that's talking about advocacy. And just before we get to questions from our viewers, I'd like to know what each of you have in mind. I'll start with you, Dr. Lowe, because you're on my screen right at the moment. How can citizens take part in advocacy for better health so that we can get the government to aim higher?
So we've certainly seen that during the pandemic, there were a lot of demonstrations, some done the right way and some done not so well. And we have seen that the government is responding and has heard and have changed things up. It's sometimes taken a little while. We saw that with the vaccinations at the beginning of the pandemic. So what I'd like to encourage everyone is to get involved in advocacy, whether that be joining an organization like CARP and having a voice and answering the surveys. When those surveys get circulated around, they're very powerful when we have accumulation of information and people's thoughts and what they're facing for issues and problems. Because the problem with government is they're not on the front line seeing the issues, and it takes something to expose it. We'd hate to actually expose things like what we saw in long-term care when the pandemic hit. We'd like to catch it far ahead. And I know many people on this call and lots of us have experienced the long-term care issues in long-term care facilities way before it got exposed by the pandemic. We knew as people, as the people there, and having our elders and family members in those systems, we knew. And if we got that out in surveys in large numbers, if we advocated through CARP and your patient advocacy groups, whether it be through Arthritis Society and the many different patient advocacies that are available to join across Canada, spend some of that time and effort to see how you can help out, to answer the survey so that that data can be brought forward to government so that there's something to act on. There are more powerful ways and efficient ways to do it. And now that we've got electronic tools, we can have validated surveys that show some very powerful conclusions, including different studies that we might do. And that's the other thing, is to maybe fund studies that actually look at the problems that we have so that we have data to present. Because we do see that government's more responsive to data than just opinions that are just thrown out there because they're kind of one-off and not systematic. But when we do it well, and I'm a researcher as well, as Dr. Batist, you got to have solid data, you got to do the studies. And if we can have that together, I'd like to encourage everyone to get involved. Clinical trials, studies, etc. Get involved, advocate.
Great. Dr. Batist, do you have anything to add about how citizens can better take part in our desire to aim higher for healthcare in Canada?
Well, I think Alan, described it, I think the most solid way to approach this, but I think we have to personalize this as well. I think groups of people should be asking to meet with their representatives at all levels of government and talk to them and explain to them and come back and ask them to meet with larger groups. I think we really have to put the politicians, not in an angry way, but in a positive way, on the spot so that they can respond. The issue really is that the healthcare system is structured in the context of our politics, where we have 4-year terms or whatever, short terms. And we know that return on major investments often take longer than that. And so politicians are a little short-sighted, but we need really to explain to them the urgency of what we're facing. And I think the pandemic provides us all with it's one of the ways that we can use it to make the argument that there are consequences to not making decisions. And I think one-on-one and a group of citizens talking to their representative can be quite powerful.
Great. Trish, anything to add from the arthritis point of view? You have a lot of experience in advocacy.
Yes, we love to advocate. And I'm going to do my pitch right now. If anyone out there cares about arthritis and would like to be an advocacy volunteer, we have volunteers across the country. They are on the ready, whether that is for a political campaign, for a particular issue that's coming up in that province. And we use those volunteers to be in the meeting with us, to help us craft the strategy and all those kinds of things. We really take a very active and serious role with everyone who is actually impacted by arthritis to please help us advocate on your behalf. And so we welcome volunteers at any time. The other thing we often do is we have specific campaigns, and I just put this in the chat. We have a specific campaign around joint replacement. So we're working to get that petition numbers up. And so we're up at close to 3,000. It'd be great if we could go over that. That's another way, very, very simple. It just basically says we want to reduce wait times in this area.
Bill, can I just add?
Yes.
Yes, I actually want to give everyone a bright spot recently, as was mentioned, the PMPRB that plays a role in regulating prices put forward a plan that would have, generated a lot of money perhaps, but would have absolutely squelched innovation and investments in research in our country and decreased the number of new drugs brought to us even through clinical trials. And we were already seeing this. And really, it was advocacy by groups of people in all different domains with concerns about a variety of different diseases, going to various MPs, ministers, federal, provincial governments, fighting in the courts. And this has been reversed. And we saw in December 2020, the government had to yield to Pfizer in order to not to bring these in order to get us all the vaccine, and that was a hint to us that this could not be set in stone, and that there was a negative correlation between the regulations that they wanted and our access to the treatments we needed. And so it's a bright spot in that they've basically backed down on the most difficult parts of it very recently, and I think advocacy won, and I think that's a very bright spot, and it should encourage us all to know and believe that we can make a difference.
Yeah, Dr. Batista, if I could add to that, another thing that happened during COVID was hydroxychloroquine became very popular. That is an arthritis drug. And so we wanted to make sure that the people who actually need that on a regular basis had access to it and that it wasn't being diverted for COVID cases. Again, all advocacy based, but it made a difference. It really made a difference.
I just wanted to also echo all of that, and definitely with the voice that those PMPRB changes, which is the Pandemic Prices Review Board, really reversed their decision because of that advocacy. And remember, those guidelines were in introduction and implementation kind of over the last 4 years. And so certainly there's a very strong federal push to have those put into place. And if it were not for all the submissions, all the contributions and advocacy that was going on, it certainly wouldn't have changed it. And I see in the chat that, people have recognized that meeting with your MP does work. And I just want to introduce another method. And I know some of you here have both good stories to tell as well as showing where the problems are, is to invite your MP or your representative to actually see what's happening at the front lines and which you do. Everybody is contributing in different ways. And this just actually twigs something. Actually, tomorrow, I've got one of the ministers in the province of BC coming to visit my pharmacy to take a look. And we're going to talk about both the good things that are happening as well as the things that need some improvement. And so if they see it first line, it's certainly more impactful. And I think that they're trying to help. They've got limitations and other issues, but they need to understand. And if we don't provide that communication and show them where the outages are, certainly they're not going to get fixed. So we do have to have that communication. We do have to have the advocacy. Sometimes it takes a large group. And I'm working with the BC Pharmacy Association, which helped to bring in a minister so that they can come to the pharmacy and see what's going on.
Terrific. Well, thank you very much for that discussion. And it is so important to remind everyone that the real advocacy happens at the grassroots level. We at a national level can talk and be heard as much as we may want, but it's only when politicians or candidates, in the case of provinces where you're having elections, when they hear directly from voters, people who vote for them, that's when politicians really listen. So this is the time to get out and give your personal story to your local politicians and candidates and make sure that they understand that you want Canada to aim higher for healthcare. We do have a lot of questions in the chat, I think, Anthony, so I'll ask if you will bring those forward, please.
Thanks, Bill, and thanks for everyone's participation. I'm learning a lot here. One general theme in the questions, Bill, and maybe to all the panelists, is about who's going to pay for all of this. So we saw, Bill, in your charge that Canada's lagging behind. Is it a matter of throwing more money at the problem, or are there solutions with the budget that we already have in place?
Who'd like to take that one?
Sure, I'll start. I did mention before that an investment in healthcare will pay off in the end, and I truly believe that. And although, it is going to cost a little bit at the beginning, it's no different from all of our big capital investments that we do that are publicly funded, whether it be building a bridge or whether it be building low-cost housing, et cetera, et cetera. It needs that initial investment. But if we get into preventing healthcare problems, preventing sickness, keeping that productivity high, and saving all the other expenses that come when somebody gets hospitalized and or needs a surgery and or needs the expensive treatment, we can certainly do better that way. And so it might be a short-term investment. And this is what we've always run up against, is with 4-year cycles and those kinds of things happening with government elections. It's hard to plan long-term. And I think we have to hold our government to a higher standard. And, the theme here is aim higher. And I think we can do that. We haven't been planning as long-term as we should in healthcare, and now we need to. It's a big cost center for sure, but also healthcare is one of the most important things to life and to living. And as somebody's already mentioned, a healthcare economy is probably more important than the financial economy, because we all want to essentially live healthy lives, and we're not productive and can't contribute if we don't have that. And so I think Trish was going to speak.
Yeah, this is a topic near and dear to my heart because I am an accountant by background. And in everywhere that I have worked, the objective needs to always be, how can I get more productivity at the same or lower cost? In Canada, I think one of our very, very difficult decision points is around that structure. Every province, regarding how big or small, does their own healthcare delivery. That is extremely costly. It means it's not universal across Canada. It means that we do not have a way to access things through technology that could be national versus provincial. I'm not saying necessarily that you don't want local delivery, but we have a lot of cost embedded in a lot of the administration, governance, engineering, et cetera. And those would take a lot of kind of courageous decision-making around how to get some of those back into the more of the front line. And I think that's, that is definitely a difficult, but that is one way that might be helpful.
All right. Next, yeah, go ahead.
Just to follow on that, I think all those things are important, but I actually think even innovations in our accounting, how we think about healthcare has to change. And there is a concept of value-based care, where we don't look at the number of surgeries done, but we look at the outcomes for the patients and what it costs to get a good outcome, and which systems are actually providing better value in terms of patient outcomes, and steer towards those. More transparency in what's happening in our hospitals and in our community health care clinics, so that people can choose, and that we can move towards the most cost-efficient and value-based care models and systems. And that will, in turn, force other institutions to rethink what they're doing and to bring their value per dollar in terms of patient outcomes into a better frame. So I think even our accounting of it can drive innovation and change.
Mm-hmm.
Good point. Anthony, another question?
Yeah, there is, and maybe following up on Trish's point, the Canada Health Act as the funder and the provinces as a delivery mechanism. How can the viewers across the country today best advocate when the province blames the federal government and the federal government blame the province, and it tends to get them off the hook when we bring these to their attention? What's the best course of action for everyone listening in today?
Somebody like to tackle that one?
I'll try and tackle that. So I'm going to speak from kind of my Medicines Access Coalition involvement in BC. We're a not-for-profit group advocating for the fair and equitable access to medicines in BC. However, we often work upstream nationally to speak with the federal groups in order to make sure that drugs make it to Canada so that they can make it to BC. And I find that kind of a similar concept here, in that we have to, I guess, advocate not only in your local, but also join national groups and advocate nationally and keep it consistent. so that we aren't speaking, completely separate, which is what we're seeing with the provincial governments and the federal governments. They're very much focused on their individual responsibilities and not so much taking a broader role to look at the overall needs across the country. So, as a coalition, we focus both regionally, but also in a consistent fashion, advocated and spoke on issues federally, but in the same way. And that certainly our provincial groups don't necessarily do that. They sometimes focus on one province with the detriment of others. And that's something that we can do differently and better, so that as we advocate more broadly in a national sense, and I think as advocates, we do that because we're frontline and we're the receivers of the care, that we are looking, not to beat up Alberta, so BC's better, or not to beat up another province. We're trying to get it for all Canadians. And that's something that an individual provincial government, they see the responsibility is so solely focused on their own province that they will take another province out to the cleaners in order to get ahead in their way. And just because of maybe their mandate or whatever it is. So we can advocate to them in a different way to look out for Canadians and not just an individual region.
I think too, I'd like to add to that. I think I totally agree with you, Dr. Lowe, and adding to Dr. Batist, data is really a driver. So if nationally we say we must have mortality rates from cancer down to X, that is the target for Canada, then you are rallying provinces and you could convert to an outcome-based payment model for some things that are most important to Canadians. What are those 5 or 6? And just start with a small number of key outcomes that we are driving to. And then that will help the transparency. It will help with advocacy. It will help with kind of having people focused on a goal. I think one thing with healthcare, we have so many data points, we get lost. It's too much data, it's too much information, and we can't see clearly where can we make movement? Where are the most important places? So I think that is a role that could be taken on nationally, is a kind of accountability for a national progress around objectives and goals that are super important to folks. And I think that kind of like tied to that, an area that we are seeing right now is this great resignation. And we're seeing this across, like people are fatigued. And we already had, for example, nurses, their average age was already in their 50s. I mean, they're sort of saying like, I'm done. I just went through this. Yes, I'm a hero, but I don't want to do this anymore. And we're seeing that over and over and over again. And so how are we going to be able to attract young people to take up these professions when we aren't as technologically savvy as we should be, when we encumber them with a lot of bureaucracy and administration? We're not going to attract people to these wonderful careers. So we definitely, that's another area where I think the nationally, federally, we need to have some leadership to push for those kinds of roles and responsibilities and education and enticement of people to come and work in Canada in these roles.
Thanks, Bill. Another theme that was followed by the audience was on prevention and some recommendations for programs for youth, but the personal responsibility side of our health and the theme that CARP has always talked about, it's never too late. Can we talk about the importance of changing your ways today to prevent things tomorrow, even if you are already somewhat down the road?
I think that's an extremely important point. And, I think in all the things we're talking about, there were lessons learned from the pandemic in terms of jobs and keeping it. We made working in healthcare difficult. It was incredible. It's been very difficult on all of us. On the other hand, there was an enormous amount of fluidity and flexibility. And who has a good idea? Let's try that. I think the healthcare environment might be a more exciting place to work in going forward, just because of the barriers, the things that we were able to do in record time, just because of the panic of the circumstance and maybe the chaos. And so I think that if we don't forget that urgency and we retain the urgency for change and dealing with real problems, and problems that are preset, I think we can turn this into something very exciting. And in a similar way, in terms of the pandemic, we're going through this right now. We're going through a psychological and social transition where we're not getting guidelines because the science is a little bit less clear, and personal responsibility is extremely important. And I think, we spent, say, in the cancer research domain, hundreds of thousands of dollars a year trying to demystify clinical research. But as a result of all of the science that's really come to the rescue in this pandemic, we have people walking down the street talking about phase 1 and phase 3 trials and efficacy and toxicity. This for us is fantastic, and people are understanding, or at least listening to the science of masks and distancing and adhering because it makes sense to them. And now they're using that information to make personal decisions for themselves. So I think we can then try to extrapolate that back to all the other more common diseases. We talked about obesity and cigarette smoke, all of the things that we all know is not good for us. I think that in a similar sense, people should, having gone through this, have a better sense that they're empowered. They can make a difference. They can change the course of their lives. Even now, it's never too late. I agree with that.
I'd like to extend on that as well too, and that is, you do have to take care of yourself. And I've heard this from a geriatric medicine specialist for the first time, and I have to credit him with Dr. Larry Dayan. He tells his patients that nobody is going to care for you more than you care for yourself. So you have to look out for yourself. You have to self-advocate as well. And you have to navigate this healthcare system because right now it is complex and convoluted. And you have to take on that personal responsibility to navigate and to work on the prevention piece as well as the treatment piece. And sometimes the prevention one is hard because the problem is not seen. You don't actually have that problem. But it is going to start with some medical and healthcare attention to recognize that you might have risk factors for something. So even though you're not sick yet or you don't have a condition yet, it's those risk factors that you'd like to prevent or reverse. And some guidance through your healthcare professional or others will certainly help you. And you do want to have credible and evidence-based approaches to dealing with this. We've seen how things can run awry. Trish had mentioned hydroxychloroquine, which was being diverted and used for the wrong reasons. And after some clinical trials and some testing, we found that the hydroxychloroquine did not work for the treatment of COVID and in fact was detrimental. It was harmful, but it took a test and a proper study to prove that. And when you just go by hearsay and just guessing at things, certainly we can run into problems. So advocate for yourself, get good information, access a credible source like a licensed healthcare professional who must act in an ethical and proper way is the best way to do it.
All right. Anthony, we're coming close to the end of time, but I think we have time for one more question. And I can also let everybody know that we will take note of all the questions that came in and all your comments and try to put them to good use from here on in this campaign. But do we have one more question, Anthony?
It was about shortages, Bill, and maybe in connection with the news we heard from Stats Canada yesterday that Canada is no longer just aging, but is actually an aged country. And the 60 to 74-year-olds today are that demographic who will be 85 plus 20 years hence. So as we're aiming higher for health, what should we be doing now to ensure that we have the infrastructure and the professionals in place to care for our audience today who will be aging tomorrow?
Good question. Trish, do you want to start off with that one?
Yeah, I think I go back to those models that have more of the preventative, the use of innovation and technology. Clearly, people want to stay in their homes for as long as possible. And how do we make that easy? How do we make that affordable? How do we make that accessible? I think that is going to be, we've wrangled with this for many, many years. The solution is not clear yet in terms of long-term care homes and how they should be structured to have an experience that people want to have. And I think we need to work on that quickly to get to some experiments and some testing and see what can be scaled.
I'd like to highlight, I guess, focus on kind of the human resources that we have in the healthcare system. That burnout is really caused a shortage in such a way that we're accelerating our incapacity, I guess, to care for that group and population. Certainly, we know that that group in population, as they age, are going to need more attention from a healthcare perspective. We know that from statistics and tests and studies that we've done. And with the burnout rate that we're having and all these resignations, as Trish has mentioned, that's certainly not sustainable. And just from a personal experience, I mean, I started as a clinical pharmacist working in the hospital before I've taken on other leadership roles and such. But I've actually gone back to the hospital because, you know, I felt that there was a need and a gap. And I'm now back working in the hospital. It's a casual kind of work. However, I am filling gaps and shortages, and we do see a lot of sick call that is happening. So we have to not burn out our healthcare workers and human resources, and figure out a better way on how to use technology and efficiencies in the system, not burden our healthcare providers and such with, you know, different policies and things that just make it more onerous for them to do the work, you know, additional paperwork that's unnecessary. And I will take this opportunity just to talk about how prior authorizations for medicines are really just these hurdles and speed bumps sometimes to get to the appropriate medication for certain patients. And during the pandemic, we learned that many of them got removed. They were taken away. These special authorities, these exceptional accesses were removed so that patients didn't have to go get a test, get an x-ray before they would qualify or get covered for a drug. If it was good during the pandemic, it's probably good after the pandemic to remove those burdens and to remove those exposures. So, you know, these are some learnings and things that we need to focus on that will help to improve efficiencies and decrease costs as well.
Batista, Dr. Batista, any final words from you?
You know, there's a lot to criticize in the system. I want to maybe end on a more optimistic note, because I think we all have come through something quite extraordinary. We all have enormous losses that we grieve, and are all of us in the healthcare system extremely exhausted. On the other hand, we have learned an awful lot. We've highlighted some of those things to you, and it's important that the final symptom of COVID not be amnesia, and we remember what we've learned and try to effectuate them. You've heard some of the examples because we've learned how to cut corners because we have to, and I think we have to maintain that level of energy and enthusiasm and urgency as we go forward and rebuild and build it better.
Thank you. And I love your amnesia comment. I think I will borrow that from you. Well, I'm afraid we're out of time. I really want to thank all of you who submitted questions. We will look at them all and do our best to respond or deal with them. I especially want to thank Dr. Gerald Batist, Trish Barbato, and Dr. Alan Lowe for their time and excellent insights today on this really vital issue for all Canadians. And we hope that for you, the viewers, this webinar has helped you understand that we must do much more quickly to give us the health care we deserve. One important way all Canadians can help this effort is to get engaged and start talking about it with your family, your friends, your neighbors, with the people you interact with in the health system. And for those of you in Ontario, and there are a few of you with us today, you have a great moment coming to make your voice heard. Your provincial election will be starting soon for a vote on June 2nd. Talk to the candidates about these issues, make your voice heard. And in the other provinces, please take time to call or write